Fat grafting is very interesting because it is a beautiful treatment because it's very natural. It's your own tissue, so it's something that really feels comfortable to people to have done. It's a little bit unpredictable, and here's why. Fat grafting is a live tissue graft, so we are taking fat from one area of your body and we're putting it into a new place. In order for that fat cell to survive, it has to get oxygen from blood supply. So it gets layered into your normal tissue and then the blood supply will grow into it. If I put kind of a gob of fat in like that, like the part on the outside will get vascularized because that's the portion that's in contact with the rest of your tissues. But everything in the center, if it's not in contact and is not able to get blood supply, it will not survive and will eventually your body will just reabsorb it. You have to put little single layer aliquots essentially of fat so that it's in contact with other tissue. In my hands, most of my patients who are having fat grafting procedures are having it done during their facelift procedure, and then oftentimes they'll get a good 50% of that graft to take, and then they come back and they do their maintenance treatments with hyaluronic acid fillers and things like that just to keep things up with the volume replacement.